Da, 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 da. Fancy music coming in and clicking buttons, seeing people. Hello, good. Sorry. Oh, no, no. Hello, thank you very much for joining me. My name is Christian Fludder. I hope everyone's going brilliantly with this wonderful case of social distancing going on at the moment. I've just had an error thing pop up, which is delightful. So I'm just going to click some more buttons and see if I can fix this somehow. I don't precisely know how, so I'm just going to keep on going and pretending that everything's going fine. All right, so how is everything going? Social distancing. Don't you love how social distancing going? I'm hoping that you're all keeping yourselves relatively sane and kind of entertained. I find today I brushed my hair in the opposite direction just to see how it would look. And hey, I'm still a fuzzball, which is what you expect to see with hair like mine. But we're not here to talk about my hair. We're here to talk about breastfeeding difficulty. I know we talked about this one a little bit last time, but we talked more about cranial nerves and how they can influence the function of breastfeeding. Whereas today I want to get a little bit more how is the musculoskeletal side of things? How does the musculoskeletal side of things tie in with breastfeeding difficulty? Now, you see, anytime I've got a case with breastfeeding difficulties, especially, so again, I'm going to come back to that paper that I wrote recently, especially in an instance where we're looking at a kid who's starting to fail on thriving. They're starting to decrease on their rate of weight gain. In fact, we should be doing this with just about any case of breastfeeding difficulty. Firstly, how is your training when it comes to breastfeeding management? How well do you know breastfeeding to be able to make appropriate decisions? You know, there's an entire field. I know I'm not very good at sticking people with pins and trying to find the right places with acupuncture kind of things. So I send patients to an acupuncturist. I know that herbs and spices are not my strongest suit, so I will send them to a naturopath. I don't know every single possible differential diagnosis that could be going on with a particular patient. That's why we co-manage with general practitioners, GPs. When it comes to breastfeeding difficulty, whenever you're looking at a case that has a difficulty with breastfeeding, you need to be considering involvement with an IBCLC, okay, an International Board Certified Lactation Consultant. IBCLCs are the top tier when it comes to breastfeeding management. So if you ever have a case that's got some problems with breastfeeding, you want to be sure that you've got one of them on your side helping you go along with the whole process. Now, there's a reason for this. Okay, because we need to look at things in a very particular point of view. I had a wonderful comment come back on a recent advert that we ran with Chiropractic Children's Healthcare. We were looking at breastfeeding difficulty, and I had a IBCLC / midwife / registered nurse make a comment saying, as long as you're adequately trained, that's delightful, but be sure that you are sticking within your scope of practice. And I found this was a very appropriate comment. We do have to be very careful with our scope and the claims that we're making. If you're claiming that you can help a kid with breastfeeding difficulty, you need to be sure that you know a lot about breastfeeding. So in this instance, I know a bit. I know IBCLCs know more. So if we've got a kid with breastfeeding difficulty, we need to have one of them on our team. Okay. If we've got breastfeeding difficulty, we have to make sure, could it be a problem with, is there an attachment issue? Is there a latching issue? Is there a sucking issue? Is there a swallowing issue? Could there be a pathology? Is there a bit of a cleft palate? Is there a velopharyngeal insufficiency going on? Is there a tongue problem? Is there a tongue tie? Is there a buccal tie? Is there a lip tie? There are many factors that can influence breastfeeding. And we have to be careful that we are not trying to diagnose things that are outside of our scope. So what does it come down to? When we're looking at breastfeeding problems, okay, it either ties down to, is there a pathology? Is there a problem with attach, suck, swallow? Could there be a musculoskeletal dysfunction as well? Okay, now Pathology, I leave that to the general practitioners, GPs, medical field. Okay, that way you're going to cover all your bases. Breastfeeding management technique, could there be a problem with the way that mum's holding baby? Is there a problem with the actual structure? Could there be a problem on mum's side of the scale, side of the things? That needs to be assessed by the IBCLC. But when it comes down to musculoskeletal function, chiropractors, physiotherapists, osteopaths, manual therapists, we as health professionals, that is almost our area of expertise. It is our area that we have studied most in. So we understand how this stuff works. Okay, so this gives us an opportunity now. What could create an issue when it comes to feeding? How can there be a problem? What could be an issue when it comes to feeding in regards to musculoskeletal function? Well, I posted this in my post on Instagram, if I can bring it up here. And I put it down to three main areas that can trigger off a bit of a response. Okay, firstly, could it be the tongue? Secondly, could it be the jaw? And thirdly, can it be the neck? Okay, as a chiropractor, we assess all of these areas to make sure everything is moving smoothly, because we understand that, well, breastfeeding itself requires a very concerted involvement from a whole bunch of different regions inside our body. Okay, so we need to look from the very top. So within the skull bones themselves move. Okay, it's a small movement, but a restriction in that small movement can have a big effect on the way the baby's able to suck and swallow. Okay, could it be the tongue? Okay, I have mentioned previously in previous videos, oh, I might even do a fancy thing here where I can show you. I can say, yes, if we look at this here, you know what, that's going to be too much effort. I'm just going to keep on talking. If we look at if we look at the way the tongue is working, there's a couple of different indicators. Okay, could it be a tongue tie? Now, I find tongue ties to be very polarizing. I've recently posted about this one, and you know, some parents absolutely swear by the changes after a tongue tie cut. Some parents found that they had zero change whatsoever. It was quite a traumatic and unpleasant experience for them to go through. So when it comes to tongue tie, we could have an anterior tongue tie. So a problem with the front part of the tongue there. Now, if I've got an adhesion at the front part of my tongue, it's going to stop my tongue from being able to go forwards comfortably. Okay, so this is the baby that doesn't do this kind of thing, tongue extrusion reflex. Now, if I've got a posterior tongue tie, that posterior tongue tie stops my tongue from being able to rise up. Okay, so if I can't rise up, I can't then create a good negative pressure inside my mouth that sucks milk in, that makes me drink easily. So this might be the parent who says, you know what, they suck, but the suck strength, it isn't that good. Could it be a lip tie? The lip tie is the one that sits underneath this bit here, or on the bottom side as well. Could this be stopping the lips from flanging properly? Now, that doesn't have as strong an impact on the whole breastfeeding mechanism, but it could still have an impact. Same thing with lip ties, not lip ties, cheek ties. These are lips, these are cheeks. In our cheeks, we can also have cheek ties. Now, those are called buccal ties sometimes. And now they can also create problems with breastfeeding. So we might see the parent who says, you know what, we'll have a really hard time getting the nipple in the mouth. Okay, this could be an indication that we're not utilizing the tongue properly. Then there could be the next mum that says, you know what, they get on, but when they're sucking, it's not the strongest of sucks. This then questions, could this be a posterior tongue tie? We're not getting proper suction. The jaw. Now, the jaw is another point that we could have some issues when it comes to breastfeeding function. Okay, because what we need is a properly, smoothly articulating jaw that rhythmically opens and closes, that helps to create, again, that negative vacuum inside the mouth that sucks milk in. Now, how can you tell if your child has a bit of a jaw-based issue? Well, a child who has a jaw issue doesn't like opening their mouth very widely. So they try and keep it relatively still. This is the kid that doesn't necessarily latch on very nicely. And they might have a bit of a weakness when it comes to their jaw. So instead of a nice, smooth sucking, this is something I see with posterior tongue ties as well. Instead of a nice smooth sucking motion, they become little chompers or Pac-Men, and they like to have a bit of a go at the nipple there, and we can end up with a bit of damage on the surface. That is one aspect. Another one is a jaw problem often makes a clicking sound. Now, sometimes when babies feed, they make a clicking sound from their lips, this old kind of a sound. But a click in the jaw, you hear that as well as almost feel it. So you can feel when you have your hand against the side of your baby's face there can be a little bit of like a clicking sound up at the jaw itself. Now, this can change throughout the feed itself. It may diminish over the course of the feed as everything loosens up, but at the same time, it can become quite unpleasant to a bub. So they might just do the first bit and then that's game over. They don't want to do much more than that. Now, the third one that we look at is the spine. Okay, now I'm going to incorporate the skull with the spine because we do look at the whole system here. As I said before, the skull bones can influence breastfeeding as well, but we play a lot with the spine inside children's necks. Inside children with breastfeeding issues. We're already talking about the neck. Now, how can I tell if my child may have a bit of an issue when it comes to their spine? So a lot of the time when I see a kid with breastfeeding difficulties and they have a bit of a spinal dysfunction, it's often the very top part of their neck. And we call this one the occipital-atlantal joint, C0, C1, or essentially the bit that joins your skull to the neck itself. Now, with a bit of a problem with this one, they often find that they're in this kind of a posture. There's a bit of a tilt and a turn that goes on, and they tend to favor off facing in one direction a little bit. Now, when that happens, we start to get preferencing. They might prefer to feed on one side than the other, or we're comfortable feeding on one side and we have to do that footballer hold on the other side to try and get them on properly. Or when they've started, they have a bit of a go and then they start to fatigue out and they start arching their head back, leaning back, arching off, and they become very unpleasant and fussy. This is often one that we see tied in with the upper part of the spine. And in fact, this is what we saw in the case that I wrote up in regards to that infant with breastfeeding difficulty. Now, if you'll just bear with me here a moment, I will load it up again. Oh, look at that, it's even saved from where it was last time. And with the magic of internets, I'm going to click a button and there we go. So you can see this one now. Now, when we looked at this child, we were looking at changes in normal cervical spine motion. Okay, now I said this one here, when we looked at this one, we found that there was difficulty with normal cervical biomechanics. Okay, and we saw this as extension behaviors, extending, arching, and pulling off behaviors. Now, this has been mentioned previously in a study by Adam Stewart in 2012, and he found the upper part of the spine to be very commonly associated. Now, in this child, if I can come up here, we found, now where did I write it down? It was inside the examination point. No, we included it within the appendix. So if you'll bear with me, I'll just scroll through to the appendix here. Now, we found on the initial assessment, there were more things covered in the assessment, but these were the ones pertaining to the treatment that was performed. We found two things. We found, firstly, a decreased bilateral occipital flexion and a right rotation and a right tilt on the pull to sit test. Now, why is the pull to sit test important in this situation? Well, you see, the pull to sit test is one that we can utilize to determine if there's a bit of a problem in the upper part of the child's neck. Now, the pull to sit test, we have talked about this one in a previous episode there. I wonder if I can load that one up. I'm pretty sure I did that one just recently. Yes, I did. And it is...
Hi, my name is Christian Fludder, and thank you so much for joining me. Today I'd like to talk a little bit about how manual therapy may be able...
Again, too much effort to try and find that one, so I'm just going to keep on going without actually showing the video itself. So magic of buttons, clicky, disappears. There we go. So in the pull to sit test, we found there was a right rotation. Now this actually ties in with a bit of a problem at the top part of the neck. See, when I do the pull to sit test, we would expect On pulling to sit, so the pull to sit test is the one where you hold a baby by their arms and you gently lift them up from a laying on their backs to a seated position. Now, when you pull them up equally from both sides there, we would expect their head to maintain a neutral position. Okay. Now, newborns, they might lag their head back a little bit, and as they get older, they start to generate more control inside their head until by about 3-4 months of age, they're almost starting to help with coming back up again. Now, if I have a bit of a problem on one side of my neck, that's going to come through on that pull to sit test. It's going to create an asymmetry in that presentation. So when I pull a child up to a sitting position, they might turn their head. So in this instance here, we had right rotation and right tilting going on. So this then fits in with a bit of a neck-based problem. Okay. Now, what we did is we actually performed a treatment utilizing a particular tool called a portable drop pace, or a portable extremity board. And it is actually a very gentle, it's a very low forceful method of creating a correction in the upper part of the cervical spine. See, we see the cervical spine tied in with a lot of things. In fact, here, there's a picture here, there you go. So this is the little device here. And you can see it's quite small. It fits very nicely. This little baby, her name is Rosie, just in case you're curious. And it fits very nicely behind a baby's head. We pre-position a particular bit of rotation there. So we're trying to influence one particular side. So we'll turn the head in that direction. It's always fun seeing your name. Yay. And yeah, too, because she's awesome. And we were able to perform this little release. Now, what was interesting is after the first treatment, okay, after the very first treatment, if I'm going to go back into the main body here, the first treatment, all treatment outcomes. After her initial treatment, there was a reported improvement in suck and swallow. Okay, this is great news. So this ties in with the neurological control of the neck. Now, at the same time, if we have a bit of a problem in the upper part of our neck and it stops us from being able if it stops us from being able to move our head comfortably and turn our head in a particular direction, this then could influence the whole breastfeeding process as well. So this is what we were targeting more so. We were trying to address this particular point of restriction. Now, has anyone had a sore neck before? If you've ever had a bit of a sore neck, you can imagine it's not very pleasant moving your head side to side to feed. It's not very pleasant tucking your chin in and getting a hold of a breast and actually having a proper feed. So when you're a bit sore, you don't tend to eat as much. You don't tend to eat as easily. And this could be one of the factors that was going on with this baby. A bit of pain or discomfort may have been stopping it from wanting to eat. Could a bit of a musculoskeletal restriction cause pain? In adults, certainly yes. In children, well, there is evidence out there to suggest that, well, kids feel discomfort. And if we have a bit of a discomfort in our neck or shoulder or something's going on, that may play a part in their whole presentation as well. So yes, we do need to be very mindful when it comes to babies who have breastfeeding difficulties. If we have a bub who's not putting on the weight, well, first up, we need to ensure that we've got the appropriate team involved with the management of this case. We need to ensure that we've got the proper examination and we're looking at all the right tests to determine what's going on, where is the issue, and we need to ensure that we are actually addressing that main issue. Okay, so I might wrap it up at this point there. That's been a very fun little a fun session talking about breastfeeding and the musculoskeletal dysfunction side of things and where chiropractic and manual therapy may play a role in this one. But if you have any questions or if you want to discuss a particular aspect more, feel free to shoot me a message, put a little comments or whatever you'd like. I'd be more than happy to discuss it in private, or if you want, we can even discuss it in a situation like this. Thanks very much for joining me this evening, and I hope to see you again soon.